We had the parents take the braces off, and within 90 days, her curve went from 43 degrees to 26 degrees. A massive reduction in her scoliotic curve because now her spine can oscillate, because her neck can turn, because her palate can move.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Good morning. Welcome back to the Unplugged Healthcast. This is your host, Dr. Kevin Wall. Today, I'm going to go about my podcast a little different. Often I am out there discussing the confusion, some of the misleading information, and the over-medication that goes on that has made our health so chronically ill and our healthcare system so broken. But today I want to encourage and point out some highlights. Over the last 25 years, I've seen some significant shifts in healthcare, and today I thought it'd be a chance to point those out. Most of these shifts are really targeted towards you, the consumer, you, our listeners, you, the patients. The first thing I have seen significantly different that I believe is a great thing for healthcare is you, the consumer, you, the patient, you question what the doctors tell you today. You research, you look up, you don't just take everything that's told you, every recommendation, and because there's a DR and a diploma, just assume it's always right and always in the best interest. You do the research and you become educated, and it's helped you and us make better decisions for you in your lifetime to be healthy. The second thing I see is that ultimately you know that over medication, that just pushing more and more drugs inside of your system does not produce healthy people. We know that long-term medication is not a solution for long-term health, and you as the consumers have figured this thing out. You also today understand that smoking and preservatives in your food, processed fast food, these all have a similar detrimental impact on your health. And you're considering, looking, you're researching, you're finding better ways to eat and understanding the impact of what you put inside your body. And the last thing I see that I believe is a great change is you understand alternative health is not so alternative today. That you actually consider things that used to be on the periphery as primary options for your health today. And this has came about, in my opinion, based on a landmark decision that occurred back in 1987. In fact, it started in 1976. See, back in the mid-70s, the American Medical Association had a lot of influence on how consumers consumed their health. In fact, they controlled how providers were seen, viewed, and referred to. Chester Wilk and 4 chiropractors, along with multiple health associations, including the Podiatry Association and the Optometry Association, they filed a lawsuit against the AMA for violating antitrust laws under the Sherman Antitrust Act. The allegations against the AMA that they conspired to eliminate chiropractic care, podiatry, optometry, and other alternatives as legitimate healthcare professionals. The initial trial didn't start till 1981, and it took almost 6 years, and the court ruling ruled against the AMA, finding that they had engaged in conspiracy to monopolize the healthcare market. Back in those days, if you as a medical provider and a member of the AMA, if you were found that you fraternized, referred, even dealt with these alternative professions, you would be kicked out of the AMA. There was a lot of pressure that you had to only deal with other professions within the AMA organization. Well, today that is different, and that decision has changed a lot of things. But I will say there's still a lot of monopolization going on. There is definitely some discrimination in the healthcare world still as we speak. one profession that I believe that is still a bit under the thumb of the AMA and some of the medical professionals is the world of physical therapy. See, you still have to get a prescription, and often they control and tell the therapist what they can and cannot do. I'm here today, and our show today is to shine the light on this scenario because I believe the world of physical therapy is on a shift. In fact, I believe it needs to be seen as the primary portal entry and does not need to be under the thumb of the AMA. In fact, I have invited in one of the leaders that is leading this charge and actually leading the physical therapy profession into a different world. If you guys would help me introduce or welcome into our show, Mike Cantrell. Mike, welcome to the show today.
Thanks. I'm glad to be here. I appreciate it.
Let me just set it up a little bit here because your background kind of leads into what I mean by this. You're 35 years as a physical therapist in the medical practice. You have been developing course content for physical therapists, but not just for them, for dentists, myofascial therapists, optometrists, the strength and the fitness community. You're coaching countless clients across the United States, Europe, Asia, Australia. You've been consulting professional athletes in the NBA, Major League Soccer and baseball, the NFL, FIFA, UFA, and the Australian Football League as well. You're also working as a professional consultant for the U.S. Navy SEALs. Man, my first question to you, Mike, is tell us what physical therapy is like today. Where's your profession headed? Where's it been? Where's it going?
You know, I kind of like the idea of where I think physical therapy is headed. Sometimes I get, well, I'd say oftentimes I get a little frustrated about where it's been. And I think part of that is our own governing body in the American Physical Therapy Association and in the physical therapy associations that are associated with each state board. And these state boards seem to be our worst enemies. They do everything they can in their ivory towers to make it difficult for physical therapists to practice. They don't work well or hard for PTs to create independent practices. And the reason I say that PT is going fairly well these days is because so many new graduates are realizing that they can operate more functionally and better outside of the insurance industry. So the majority of private practitioners, new graduates moving into private practice in physical therapy is bigger than it's ever been. And the majority of those are operating outside of the umbrella of insurance. So these are people who are willing to step out, be entrepreneurial, hang a shingle, and do their best to market their trade as well as they can on their own. They're not working hard for us. And in spite of them, I see young new graduate practitioners starting to thrive the further they divorce themselves from these governing bodies. It's almost like they're saying, just leave us alone and let me practice. I'll worry about how I'm going to get my referrals since you're not going to help me do it. In the meantime, these very governing bodies should be out there pointing out to the AMA, et cetera, that PTs as a doctoral graduate degree now, you know, a new grad is a doctor of physical therapy. Well, if they're a doctor of physical therapy, great, treat them as such. Increase their liability insurance if that's a concern. But whatever, let them live up to this supposed doctoral degree they've got.
Imagine a life where every movement doesn't come with a price tag of pain. At AFC, we don't just treat symptoms, we rebuild your confidence, one personalized treatment at a time. Our approach goes beyond temporary relief, targeting the root of your pain and helping you rediscover what your body can really do. Don't settle for surviving. Call us or visit our website today.
The profession is moving forward, but they're being held back by insurance standards, insurance reimbursement, and the manipulation of the AMA and some of those governing bodies. But to get outside of that and to help patients understand that, it's unfortunate we got to step outside of insurance because that's where patients kind of disconnect, right? So we got to get them to understand that there's a massive difference between the physical therapy they're getting at the hospital and the physical therapy that's available to them, because the change isn't just about rehabbing their hip. It's about getting their health back. It's about sleeping better, eating better, digest. There's so many things available to the patient that they're not aware of. Can you explain? You're the co-founder of the Applied Integration Academy. Let's explain to the audience what that really is and why that's different than typical physical therapy. why they should even seek it out.
So let me tell you a story first, and then I'll segue into the AIA. And many years ago, when I was a practitioner in my own private practice, I had 50 physical therapists, 50 employees, about 15 of which were physical therapists, and another 8 or 9 physical therapy assistants, which is a licensed profession. And then multiple wellness providers and directors. We had an Olympic-size indoor pool. This was a 20,000 square foot facility that was a multi-million-dollar operation. And this operation continues to go right now after I sold it. And this practice, with its busy insurance-driven marketplace, also had one independent practitioner within it who was outside of the insurance company, and you're talking to him right now. And I had severed my relationship with all insurance companies because I saw a need there. And it was a need for real physical therapy. It makes you wonder what we were providing otherwise. So let me explain. And this brings us to the story. I got a phone call, and one of our insurance people, of which we had a bank of them, says, Mike, there's a provider on the phone that wants to speak with you about one of the patients. I said, okay, so here we go. So I get on the phone with this provider, and the first thing this provider says is, you need to be a provider for our insurance company because I noticed that you're not a recognized provider. We want you to become one of our providers. I said, I can't do that. You guys don't reimburse enough. And she said to me, well, you'll make up for our low reimbursement by getting more volume. Now, just pause on that for a moment, and you already see the folly there, because I don't want more volume because I can't practice the way I should and treat patients with high volume. Now, she was calling about a specific patient, and this specific patient had been in physical therapy for 2 years in another place, who was a provider with that insurance company. She was there for 2 years, was getting no better, and sought me out. When I saw her, I said, I'm not a provider and I'm a cash pay practitioner. She said, that's fine. I said, I can provide you with receipts and you can use those for insurance submission if you like. She said, okay. We treated her. We began the treatment process. Now the insurance company calls. She says, what are you doing? I began to explain what she did, which is what AIA is all about. And as I explained to her what I did, she glossed over. I knew I was losing her. She has no clue what anybody does. So then, after I finished, she said, well, let's cut to the chase. How many more visits do you need us to approve for her physical therapy? And I said, I don't need any more visits. And she goes, why not? And I said, because she's well. I haven't seen her in 3 months. We discharged her a long time ago. Her question to me at that point was, what do you mean, well? I swear to you, that's what she said. I said, well, it's a little known condition in your world, but most of the people in my world, when we treat them, we're treating them to get them unpainful, better. She was a runner at Georgia Tech, and she is now running again for Georgia Tech. So she's well. She no longer needs treatment. And she said to me, so you're saying she's well? I said, yes. I don't need to see her anymore. I don't need any more visits. We saw her 3 times. And she said, you see, that's why you need to be one of our providers. And I said, no, that's exactly why I don't need to be one of your providers. You paid a provider for you across in another state, and she saw that provider, and she never got better for 2 years. Your system pays for failure. I'm not interested in failure. If I want to fail as a PT, I'll be your provider. But I'd frankly like to succeed as a PT and not be your provider. What I explained to her that I did is what I'll explain to you now, which regards AIA, this logo on my shirt that people may or may not see. The Applied Integration Academy is first and foremost an academy that digests very deeply the understanding of movement science and understands that humans are inherently asymmetrical, and the ability to shift their center of mass from one side to the other is always compromised because respiration and airflow is compromised when you can't switch sides of your body. If I can't shift from right to left and back again with efficiency, I'll still do it. I just won't do it well. When you evaluate someone through that lens, what you begin to realize is there are other entities that should be involved in care many times. First and foremost, the world of dentistry. You heard in my bio that I teach a lot of dentists how to practice. Why in the world is a physical therapist teaching dentists how to practice? Because dentists have a neurologic profound influence on human movement and kinetics. Dentists aren't aware of this, PTs aren't aware of it, and insurance companies will never be aware of it. So when this exists and dentists become aware, suddenly they realize the profound nature of what they do. I'm holding in my hand an article that I wrote for a magazine called Dental Sleep Practice. The title of the article is "The Dentist May Hold the Key to Unlocking Scoliosis." Now, that article is based on a case study where we treated a patient who came into the clinic. This is in my clinic in Houston, Texas. I live in Georgia, but I travel a lot. And my operation in Houston, Texas is part of AIA. And there, when I saw this patient, she was 13, I think, maybe 12 or 13. And when I saw her, we realized immediately that her scoliosis, had a significant curve, 43 degrees. And this 43-degree scoliotic curve needed to be treated. Well, she'd been in physical therapy for 2 years. Guess what? Under an insurance umbrella. They were providing whatever it is they provide, but her curves were getting worse. Now, you can completely understand that the orthopedic surgeon is waiting in the wings saying, if you don't reduce this curve, I'm going to put a Harrington rod in and stabilize her spine.
Of course.
The problem was, now, all I can say is who can blame the surgeon? Because the surgeon stands ready with his solution, and he knows good and well it's not a great solution, but have we got anything better? That would be my question if I was a surgeon. And so what we can tell the surgeon is, as a matter of fact, we do. If PTs can understand that a dentist can help, and if dentists can understand that a PT can help, because we have multiple articles that point out that there are issues where the two relate in the scoliotic world. Now, having said that, this patient, as I said, was in therapy for 2 years with no improvement and was in fact worsening to 43 degrees when I saw her. She was also in, for 2 years, braces. And when a patient is in braces, you will never straighten a scoliotic curve because you're limiting palatal excursion. We had the parents take the braces off, and within 90 days, her curve went from 43 degrees to 26 degrees. So in 90 days, a massive reduction in her scoliotic curve because now her spine can oscillate, because her neck can turn, because her palate can move. Do you think an insurance company is going to understand that? No. I have before-after images. They're right in this article. It's available in the fall edition of Dental Sleep Practice. Anyone can find that online. So that article basically is not only explaining how this happened in a very, fluff 2 or 3 page article, but it also has some references like Obayashi's article that speaks to respiratory exercises can reduce spinal curvature, that in the presence of a crossbite, children with scoliotic curves often have a crossbite. Well, it's because the palate is also scoliotic and so is the tongue. So there are multiple articles that speak to this. And idiopathic scoliosis is a complex disease in childhood, an article written by Al Offman. Multiple reference articles in that article explaining the relationship between dentistry and scoliosis. And dentists are not aware. Do you think that orthodontist was aware that he was creating a scoliotic curve on a patient? How's he going to know that? That's not his world. But it is mine, and it belongs to AIA. Because we wrote the book on human asymmetry. And we literally wrote the book on human asymmetry. And so the understanding of something as simple as human asymmetry is how we understand that we need to bring in professions like dentists or neurooptometrists or speech-language pathologists or myofunctional therapists or podiatrists or chiropractors or osteopaths, because the more they understand that we are all working on the same patient, and if we all speak the same language, we can suddenly see massive reductions in things like a silly little scoliotic curve.
Well, you're nailing why I created and why I wanted to do this podcast. A lot of people will have a tendency to think you and I are on different planets, and I 100% know that's not true, that actually integrating concepts and thoughts and practices to find the best of both worlds, and understanding that one thing is connected to the other is all this podcast is about. But man, you got my head reeling now, because I can think of over 36 years of practice, how many scoliotic patients, and they all mostly seem to be females more than males.
Yep.
And it all hits right at the same time that they often need braces in their teeth. So
Fact.
Are you saying that there's a connection here that we're kind of aggravating, creating, magnifying, or for sure not helping these young gals by adding braces while they're getting braces? You know what I mean? By treating their scoliosis and their teeth at the same time?
Absolutely. I can guarantee you that if we would have evaluated that, if we would have taken an x-ray the day that patient had these braces taken off and measured her Cobb angle, it would have already been less than 43 degrees. Take the braces off and have her walk in and get x-rayed, and she's going to go from 43 to mid-30s. Just like that, because it only takes 1 or 2 breaths for that curve to change. So I know that for a fact. We also know there's research that already backs that up. This isn't Mike talking, but somebody has to look and digest that research. It's out there, but we're just not aware that it's there. Somebody has to do it. That's what AIA does. We're a clearinghouse for understanding the relationships between yours and my profession. Furthermore, what we're trying to do with this article is create a paradigm shift. Now, you know this, but our listeners may not be aware of this. Many physical therapists work within a school system. And one of the things they do in junior high school or middle school, whatever you want to call it, adolescent teens, 12, 13, 14, they have them bend over and look for a rib hump and screen them for scoliosis. Okay, that's fine. At that point, if they see a significant rib hump, they say you need to go to your family doctor, who will probably send you to an orthopedist to get a Cobb angle measured, get an x-ray.
Right.
I have no problem with that. That's great. Here's what they should do. Bend them over, do the exact same thing. And if they see a significant rib hump, stand them up, turn them around, and look in their mouth. And if they're in braces, they should also say, you need to go see your orthodontist as well as your orthopedist. Let's get a Cobb angle measured and get the damn braces off. We can put those on anytime. And at that point, the orthodontist is going to say, you're taking from my revenue, at which point I would say, oh, far from it. Because if you're learned in other intraoral appliances, not only will you make more revenue, you're also going to be guiding a patient to reduce their scoliosis by using a device called an ALF, which is a device they know nothing about, but I do, because this world called AIA understands these intraoral appliances very, very well that help human movement by reducing the neurologic drive that causes the scoliosis in the first place. So an orthodontist should be happy as a lark that we're turning them around and looking in their mouths, because at that moment, that orthodontist is going to understand, oh, I've got a fix here and I can help. And I got to tell you, most orthodontists really want to help. They just have no idea that they're causing a patient who's 42 years old to have urinary incontinence the minute they put them in braces.
Is chronic pain holding you back? At AFC, our team is committed to your well-being. We provide holistic care, including chiropractic, physical medicine, immunotherapy, detox programs, and more. Our experts target the root cause of your pain for lasting relief. Book your consultation online or by phone and experience our smooth process. AFC, embrace a life without pain.
Wow. And they've never, ever connect the dots or even think about connecting the dots.
Neither does the patient.
Well, the patients have been so brainwashed, and I talk about this even on my last podcast, is the pain has nothing to do with the problem most of the time. In fact, the location of the pain is almost the worst thing you can look at, because people get so stuck on that they can't see the forest through the trees, right? Man, is this what you call, you've coined this respiratory neurodontics? Is that this term, or is that what we're talking about here?
The Applied Integration Academy spends a great deal of time in front of dentists and physical therapists and chiropractors explaining this concept called respiratory neurodontics. And basically what we're trying to convey is bodies must breathe. And the effort to move air and stop myself from falling down are paramount in humans. I don't want to fall and I must breathe. And as long as I'm going to keep myself upright, I'm going to make sure I'm breathing. And as long as I'm breathing, I'm going to make sure I don't fall. And I'll do whatever it takes to do those two things. And most of the time, it's compensatory. And those compensations lead to the orientation of my teeth. They lead to the orientation of the palate that contains my teeth and the mandible. So my upper jaw and my lower jaw that house these teeth move. And my skull bones move. They expand and contract. I breathe with my skull. There's tons of research in these books behind me. One of them is called The Master and His Emissary by Gilchrist or McGilchrist. He speaks in there about something called Yakovlevian torque, which is the twisted brain. It's a scoliotic brain. We all have it. So our brains are literally asymmetric because of the orientation of our skull. It's why people get a herniation of a cerebellar tonsil on one side or the other. Because these Chiari malformations are formed by the twist that we all have because we're either trying to breathe well or trying not to fall. It creates a twist. Well, that's okay. We just need to know that exists so we can initiate our management from there. I can tell stories all day long about my patient with a significant Chiari malformation who was under the gun to have surgery. This lady was passing out at least 7 or 8 times a day. The first time I saw her, she passed out on my exam table because of the Chiari. She was told she didn't have a Chiari malformation, but they didn't do her MRI in standing. And when you do an MRI in standing, you'll see the cerebellar tonsil herniate. So she had a grade 1 Chiari malformation that they said wasn't significant enough. But she had a grade 2 when she stood up and was MRI'd in a dynamic MRI. Whoa.
Well, Mike, without question, you have illustrated with research and obvious examples that a lot of providers, a lot of insurance companies, a lot of patients are just missing opportunities, not so much even to get reimbursed, but to get patients better, to get results, to get changes. And a lot of things people say never get better. Scoliosis, issues inside your brain. People just get written off, get labeled, and they're left in a pile of chronic, uncorrectable conditions. We got to get people to just understand, maybe take it from the high level thinking and understanding that you and I understand to maybe something people can connect to and apply to themselves.
Well, I think that first and foremost, what is needed is a comprehensive exam for people to understand the nature of why they're hurting, why they're having problems, why they can't perform. And a comprehensive exam that is multidisciplinary is very, very appropriate. And it can answer questions about why they've got a bunion, or it can answer questions about why their knee hurts all the time, or their back, or why they've got shoulder pain every time they throw the baseball, or why their big toe hurts when they serve the tennis ball. And we can take these diagnoses like that rotator cuff problem and help that patient understand that it's a respiratory issue and that's why their shoulder hurts. And if they can understand, and the trick is not knowing that that's what the problem is. The trick is helping the patient understand that that is the problem, that it is always based on movement and the inability to do that without compensation. So I don't know if I'm answering your question the way you're framing it, but I hope I am.
If I just maybe summarize, so to speak, we got connections between how our mouth is, where our tongue sits, how our jaw is, how we breathe, the diaphragms in our abdomen, the diaphragms in our pelvis, all these things that move and change when we move and when we breathe. And if we're not actually symmetrically shifting from left to right, we're going to end up with bunions. We're going to end up with knee problems. We're going to end up with rotator cuff. And then all that happens to those patients is they go to the typical physical therapist or the orthopedic or even the chiropractor, and they're either working on their rotator cuff, they're adjusting their spine, they're giving them a brace for their foot. And so the person never gets an answer. They just get a patch at best. Is that really what we're saying?
1,000%. If I could reach through this phone and hug you, I would, because that is exactly what it is. Exactly.
So how do they get out of these syndromes? How do they find providers like you, physical therapists that understand this, or even orthodontists? But I assume you've trained multiple specialties and how to work within this model, correct? How do we find them? How do patients find them?
We are busier than we want to be. So we're trying our best to train practitioners everywhere. And so the first thing they could do is go to the Applied Integration Academy website and submit a contact form. And there we can direct them in their geographic region who's available. And then from there, they can go see who can help them in their region. And if there's no one in their region, we can direct them to who's the nearest. And as we continue to grow the academy, we'll see more and more practitioners that are credentialed and can do what it is that we do, or what we'd love to see them be able to do. So that's our mission. And if they start by going on our website, they'll find what they need.
It sounds like, though, we need them to go and tell their providers to consider contacting you
1,000%.
or get involved with AIA or learn some of these things. And if we can get the patients, as I started my podcast, the reason healthcare has shifted isn't because of a lawsuit back in 1987. It was because patients finally got the chance to ask questions, to push their providers, to question what was going on and why it wasn't getting better and why it doesn't make sense. These are all things we need to do as people, as providers, as patients. And when we ask the right questions, we start to get the changes. But we need to maybe go back to our providers and ask the questions. Why I'm not getting better? Have you ever heard about Applied Integration Academy, and maybe push them that direction?
I'm so glad I had this time to talk with you about this, because that is exactly what they should be doing. And if they're asking their providers and speaking rationally with their providers, these providers, they can have paradigm shifts just as well as you and I can, and learn that it isn't alternative medicine. This is medicine. You know that old doc that used to make the house call to leave it to Beaver's house? He was onto something. He actually treated Beaver. Nowadays, I don't know what they're doing.
This again, if you've listened to my podcast, I've actually referenced that exactly. That we need to go back to the days of the Waltons, where there was one doctor in each county, and he actually had to understand everything about everybody, and that was a good thing. So if we could just preach this, and people are probably tired of me preaching it, but I'm glad you got on with me so we could preach it together. That there are answers, there are solutions, but they're probably not going to be found in the typical allopathic, go to my primary care doctor, get a prescription. There hasn't been answers. That's why we're in the mess we're in today. But people like you, providers like you, and patients like I'm asking are the solutions to change and move the needle. We got to get off the fixed ideas of what we got is what we're always going to get.
Kevin, thank you so much for the opportunity to point this out. This platform is a good one, and it needs to be out there more.
All right, Mike. Well, I think we're going to wrap this thing up. We've had every technical problem in the books that tried to stop us from getting this message out. Thanks for persisting. And if you're still on this podcast listening, thanks for listening. Here's my favor of you today. You need to first off share this podcast to somebody that needs to hear it. But maybe it's your providers, because we're not throwing rocks just to actually try to piss people off or make people angry. We're just trying to change what's happening in healthcare. And Mike's doing this in the world of physical therapy. I'm doing it in the world of functional physical medicine. But if we all start doing it together, we can make a difference. So, Mike, thanks so much for joining us today. I'm going to sign us off. But if they do want to find you or connect with you directly, how would they do that?
So they can either go to the website, Applied Integration Academy. They can find Applied Integration Academy on Instagram and Facebook. And they can also find me, Mike Cantrell, on Instagram as well. So those are some places where they can find. If they need to DM me on Instagram, that's fine. Or they can email me at mike@youraiateam.com.
We'll get all that in the show notes, so you got no reason. If you want to change, then try something different. And here's a chance, and here's an opportunity. Mike and his team are ready to help you. So, all right. Well, Mike, thanks again. You be blessed. And if you're listening to this podcast, you always remember, be healthy, be blessed, never give up. Never give in. We'll see you again on the next episode of the Unplugged Healthcast.
The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.